As of March 26th, over half of the states, 29 of them, have requested and received approval for their Section 1135 waivers. This can only happen if there's a public health emergency and a national emergency, and we have both of those, which means states can now ask the Centers for Medicare and Medicaid Services for more flexibility in their state Medicaid program. CMS, when updating their statistics, issued a statement that said these waivers offer states new flexibilities to focus their resources on combating the outbreak and providing the best possible care for their Medicaid beneficiaries. And flexibility can look different in each state. It could be streamlined provider enrollment, reimbursing out-of-state providers, allowing more flexibility and things like waiving prior authorization requirements, or even extending deadlines for things like appeals and requesting fair hearings. CMS actually has a toolkit available that gives templates that states can follow to see what options they have for requesting flexibility. Now, some states are going so far as to pair the request with an additional Medicaid waiver request. This comes out of a separate section of the Social Security Act, Section 1915C, that allows flexibility in home and community-based services. There have been 4 states so far that have requested and received approval for that additional waiver, all under the guise of trying to make it easier to get services to Medicaid beneficiaries and to have providers accept those patients so they can get the treatment and services that they need. Now, these waivers are effective as of March 1st through the duration of the emergency. And the states that have not requested waivers yet, they're not staying out of this. They're working on it. There has been confirmation that other states do have letters in process to CMS requesting their own flexibility, and we will keep you posted as those letters get submitted and approved. Now, CMS also issued 2 additional statements when updating their statistics on the number of states that have requested and approved these waivers. They said, we will continue to expeditiously review and approve as appropriate all Section 1135 waivers and other requests that the agency receives to ensure that they are providing our state partners with the maximum flexibility they need to care for their Medicaid beneficiaries during this public health emergency. And the average turnaround time for CMS for these requests is 7 days. That's pretty fast for a bureaucratic process that has to go through a lot of negotiation with state government and federal partners. If you want to read more on the CMS process, they have a new website called Current Emergencies, and we link to that in the description below. They also have an updated Medicaid State Resource Center website. It's becoming more popular as state governments and Medicaid offices see what their options are, get their request together, and submit it to CMS.